Welcome to The Explainer. Today, we're going to break down attention deficit hyperactivity disorder, or ADHD, by taking a close look at what the clinical data actually tells us about this pretty complex condition.
So, here's what we're going to walk through. We'll start with what ADHD is at its core. Then we'll get into how it's diagnosed, what other conditions often come along for the ride, and finally, how it's actually managed.
All right, let's dive right in. First up, what exactly is ADHD? We're going to get straight to the heart of it and unpack its core symptoms. So what does ADHD actually look like in the real world, beyond just the name? Well, the clinical data points to two main buckets of symptoms.
At its very heart, ADHD is all about a persistent pattern of inattention, hyperactivity, or, in a lot of cases, a mix of both. And this is where you can really see those two sides of the coin in action. Inattention isn't just about spacing out. It's stuff like making careless mistakes over and over, or constantly losing your keys. And hyperactivity isn't just being bouncy. It can mean talking nonstop, or finding it almost physically impossible to just sit still. The key word here is pattern. It's not just about one-off incidents.
It's just as important to talk about what ADHD is not. The clinical data is really clear. Serious behaviors like cruelty to animals, that's not a feature of ADHD. And this is a big deal because mislabeling these kinds of behaviors can actually prevent someone from getting the correct help for a totally different condition.
Okay, so recognizing those symptoms is one thing, but getting the diagnosis right, that's a whole other ballgame. It's a real art, mostly because a few other conditions can look a lot like ADHD on the surface. So when a clinician is looking to make a formal diagnosis, they're really hunting for two key things. First, the symptoms had to have shown up early, like before the age of 6. That points to it being developmental. And second, the behaviors can't just happen in one place. They have to be everywhere, popping up consistently at home and at school.
And this is where things get really interesting, especially when you try to tell the difference between ADHD and something like oppositional defiant disorder, or ODD. With ADHD, a kid might interrupt because they just can't control the impulse. But with ODD, the behavior is often intentionally defiant and annoying. It really all boils down to the why behind what they're doing.
It's a similar story when you look at autism spectrum disorder, or ASD. Yeah, on the surface, some behaviors might look similar, but deep down, the core issues are totally different. ASD is really about challenges with social interaction and having restricted, repetitive behaviors. That's just a world away from the inattention and hyperactivity that are the hallmarks of ADHD.
And this is exactly why getting that diagnosis right is so important. See, ADHD almost never shows up to the party alone. It often coexists with other conditions, what the pros call comorbidities.
And I mean, it is super common for ADHD to have these, let's call them plus ones. The data shows about a 25% overlap with conduct disorder, 30% with anxiety, and a really significant 50% overlap with Tourette's syndrome. Yeah, let's just stop and think about that Tourette's number for a second. 50%, half of all cases. That is a huge clinical signal. It just goes to show how deeply connected these two conditions can be, and that's critical information for anyone trying to get the right treatment.
So when you put all this together, the core symptoms, the other conditions, you can see how it starts a kind of domino effect of real-world challenges. Things like struggling in school can be a direct result. That inattention can lead to more accidents. And the source material points out a really serious long-term risk, a much higher chance of developing substance use disorders later in life.
All right, so with this really complex picture in mind, how is ADHD actually managed? What does a treatment plan even look like?
Well, the approach is actually pretty straightforward. It's a clear, step-by-step pathway. The first thing doctors usually try is a psychostimulant, like methylphenidate. It sounds kind of backward, but these meds help increase brain activity to improve focus. If that's not the right fit, then they move to a second-line non-stimulant option like atomoxetine.
And the source material is crystal clear on this point. While other things like therapy can definitely help, the main #1 strategy for managing ADHD is pharmacological treatment. In other words, medication.
Okay, so let's zoom in on methylphenidate for a sec, since it's the big one, the most common starting point. But, and this is a big but, using this kind of medication isn't just a free-for-all. It needs careful management. Some common side effects are insomnia and weight loss, so it's absolutely essential for doctors to keep an eye on things like blood pressure and body weight to make sure everything's safe. And that whole insomnia risk?
It leads to a super simple but absolutely critical rule of thumb. Timing is everything. It has to be taken in the morning or afternoon, but never at night. Why? Well, you're just asking for trouble with sleep if you do.
And hey, just as important as what to do is what not to do, right? The source is very specific that other types of drugs, like antipsychotics or antidepressants, aren't the right tools for treating the core symptoms of ADHD.
So let's pull this all together. We've seen that ADHD is a very real condition, defined by those core symptoms of inattention and hyperactivity. Getting the diagnosis right is so important, partly because it hangs out with other conditions so often. And finally, the primary way it's managed, according to our source, is through a really clear medication plan.
And that leaves us with one last thing to think about. Since the clinical guidelines lean so heavily on medication, it makes you wonder, what role could other therapies and strategies play in the future to provide care that's, truly holistic for this really complex condition?